There's no simple stopwatch for pancreatic cancer. Its progression isn't one speed. It's a range influenced by several critical factors, and understanding them is key. When we talk about how fast pancreatic cancer progresses, we're delving into a complex interplay of biology, timing, and individual circumstances. Let's unpack this intricate process to arm you with the knowledge you need. At the heart of pancreatic cancer's progression is the tumor's own biology. This isn't a one-size-fits-all disease. Some subtypes are inherently more aggressive, racing through stages with alarming speed. These poorly differentiated tumors can multiply rapidly, overwhelming the body's defenses in a matter of months. On the other hand, certain pancreatic cancers grow more slowly, taking years to reach a critical mass. The genetic makeup of these cancer cells dictates their behavior, setting the baseline for how quickly the disease will advance. But tumor biology isn't the only player in this high-stakes game. The stage at which pancreatic cancer is discovered is perhaps the most crucial variable in determining its progression. Imagine finding a tiny stage 1 tumor by chance during an unrelated medical scan. In this scenario, you might be looking at years before that tumor becomes clinically significant. It's a rare but hopeful situation. However, the stark reality is that most pancreatic cancers are diagnosed at later stages. By the time symptoms appear and lead to a diagnosis, the cancer has often already demonstrated a rapid and aggressive growth pattern. This late discovery can mean the difference between a manageable illness and a dire prognosis. To provide a general timeline, it's important to understand the journey from the initial development of a cancerous cell to a detectable tumor. This process can span many months to a few years. During this time, the cancer is silently growing, evading detection. Once symptoms begin to manifest and lead to a diagnosis, the landscape can change dramatically. Without effective intervention, the disease can progress rapidly, often over a matter of months. This is why the medical community emphasizes the critical nature of early detection and swift action. Treatment, however, can significantly alter this timeline. Think of effective therapies as pressing pause on cancer's relentless march. Chemotherapy, radiation, or surgery can dramatically slow progression, halt it in its tracks, or even shrink the disease. This is where hope enters the equation. Modern treatments have the power to effectively pause the clock for a significant period, giving patients precious time and improved quality of life. The impact of treatment on progression cannot be overstated. It's a powerful tool in the fight against pancreatic cancer. Yet, the story doesn't end with tumor biology, stage, and treatment. Each patient brings their own set of factors to the table. Overall health, age, and the ability to tolerate aggressive treatment all play roles in how the disease course is managed and perceived. A younger, healthier patient might be able to withstand more intensive therapies, potentially slowing the cancer's progression more effectively. Conversely, an older patient with pre-existing health conditions might face additional challenges that could impact treatment options and, by extension, the speed of disease progression. Understanding these variables is crucial, but it's equally important to recognize the urgent message underlying all of this information. The variable progression of pancreatic cancer underscores why early detection before symptoms start is the holy grail of pancreatic cancer research and treatment. Until we have reliable methods for early detection, it's imperative that any warning sign, no matter how subtle, demands immediate action. In the realm of pancreatic cancer, time is the most critical resource. This complexity in progression rates is precisely why pancreatic cancer research is so vital. Scientists are working tirelessly to develop better early detection methods, more effective treatments, and deeper understanding of the disease's biology. Each breakthrough brings us closer to changing the narrative around pancreatic cancer progression. For those facing a pancreatic cancer diagnosis, or those supporting loved ones through this journey, understanding these factors can be empowering. Knowledge is a form of control in the face of uncertainty. By grasping the nuances of how pancreatic cancer progresses, patients and their support networks can engage more effectively with their healthcare teams, make informed decisions about treatment options, and mentally prepare for the road ahead. It's crucial to remember that while statistics and general timelines provide a framework, every case of pancreatic cancer is unique. The interplay of factors we've discussed means that no two patients will have identical experiences. This individuality is both a challenge for treatment and a source of hope. It means that even in advanced cases, there's always the potential for a better-than-expected outcome. As we continue to advance our understanding of pancreatic cancer, the landscape of progression and treatment is evolving. Immunotherapies, targeted treatments, and combination approaches are offering new avenues to slow or halt the disease's advance. These developments underscore the importance of staying informed and connected with the latest in pancreatic cancer research and treatment options. For those not directly affected by pancreatic cancer, this information serves as a powerful reminder of the importance of overall health, regular checkups, and prompt attention to any unusual symptoms. While pancreatic cancer can be aggressive and challenging to detect early, awareness and proactive health management can make a difference. In conclusion, the progression of pancreatic cancer is a complex journey influenced by multiple factors, from the inherent biology of the tumor to the stage at diagnosis, from the impact of treatment to individual patient characteristics. Each element plays a role in determining how quickly the disease advances. This variability is precisely why early detection and immediate action are so critical. Every day counts in the fight against pancreatic cancer. Understanding the enemy is indeed the first step in the fight. By arming ourselves with knowledge about how pancreatic cancer progresses, we're better equipped to face this formidable foe. Whether you're a patient, a caregiver, or simply someone seeking to understand this disease better, remember that information is power. Use this knowledge to advocate for yourself or your loved ones, to support pancreatic cancer research, and to spread awareness about the critical importance of early detection and swift action. Time is of the essence with pancreatic cancer, but hope is not lost. With ongoing research, improving treatments, and growing awareness, we're making strides against this challenging disease. Every bit of understanding we gain brings us one step closer to better outcomes, and, ultimately, to a world where pancreatic cancer no longer holds the power it does today. I'm Dr. James from Pancreatic Cancer Warriors, and our mission is to empower through knowledge, to fight through understanding, and to never give up hope in the face of pancreatic cancer. Remember, awareness and action are our most powerful weapons. Stay informed, stay vigilant, and together, we can make a difference in the fight against pancreatic cancer.